The stigma against the mentally ill poses a problem for psychologists who attempt successful treatment of mentally ill patients. Psychologists' main goal is treating mental illness before it becomes more serious, which can progress to violence. MentalIllnessPolicy.org states that make it easier to treat people with mental illness have lower homicide rates. So how do we treat mental illness? Patients seek out help. Patients that seek help without being forced or shamed to do so are the patients psychologists can help the most. Acknowledging there is a problem and that problem is not too great to be tackled is half the battle in keeping mental illness from progressing. TreatmentAdvocacyCenter.org says, most acts of violence committed by individuals with serious mental illness are carried out when they are not being treated. If a psychologist can't treat patients with mental illness, patients will inevitably progress to serious mental illness, which can lead to violence. Herein lies the problem. Mentally ill patients that are halted by the stigma against them will not seek help. The Secretary of Health and Human Services says, fear and stigma persists, resulting in lost opportunities for individuals to seek treatment and improve or recover. The second, perhaps most coincidental part of this problem is violence. Violence is the main cause for this stigma. While other factors such as substance abuse and pre-exposure to violence can lead to violence, it stands to remain that not receiving psychiatric and psychological treatment is the highest contributor for violence in mentally ill patients. The vicious cycle of the mentally ill patient not seeking help, then progressing to serious mental illness, which left untreated can lead to violence, which then leads to stigma. The stigma contributes to the initial problem of mentally ill patients not seeking help. Stigma can only worsen mental health and making psychologists' task of treatment problematic.